right, and we are all set. Good to go.
Cool.
Perfect.
Hopefully I'll get it in the first take now, Ian.
That's fine.
We're a little bit, well, I'm a little bit nervous, Ian, because I haven't, we can leave this in the podcast. I haven't had a sound technician here with us before.
Oh, you're good.
So
You're natural.
hopefully we'll. Thank you. So hello everyone, David here. Welcome back to the DGR podcast. This is episode number 39, being recorded in New York City. First in-person podcast. I'm delighted to welcome amazing guest Aleena Kanner. I think that's how you pronounce your last name. Yeah. So we hired out a cool little studio here for this episode today, and yeah, it's cool.
It's very cool. Thank you for having me on your podcast.
You're welcome.
Very excited to be here.
Yeah.
Yeah.
Do you want to tell us a little bit about yourself?
Sure. So a little bit about me. I'm from New York. Pretty much born and raised here. Was a gymnast growing up. Kind of throughout understanding my body through gymnastics, I knew at a pretty young age that I wanted to work with people with their bodies, but I didn't exactly know what route that was going to be. I went to grad school at the University of Arkansas, which for a New Yorker is pretty wild to go all the way to Arkansas, but I loved it.
I have no idea where anything in America is.
So it's like kind of on top. So there's Texas and Oklahoma, and Arkansas is like on top. So it's in the pretty much middle of nowhere. Mm-hmm. It's beautiful. Hikes are beautiful. So I went there and studied athletic training. So in Europe, I would be an athletic physio. Here, I'm a certified athletic trainer.
Mm-hmm. I don't think athletic physio. Might be...
Would it be?
They have athletic trainers now as well.
Oh, okay.
And then they have like sports physio. It might be more like it's sports physio. Yeah.
Yeah. So that would be my cert in another country. Mm-hmm. So I did my master's in that, and then after that I came back to New York, and was here for about 4 years, and decided the city was way too much for my body. Mm-hmm. COVID happened, and I've been in Texas for the last year and a half. But now I'm here for the summer and have this awesome opportunity to do this podcast with you. So I've been studying PRI for I started studying it in 2018, but more the last 2 years. Mm-hmm. But I always worked with the body, and here we are, just learning, and every day's a new day of new information. So,
what's PRI?
Oh, great question. So
I think we'll talk about like a lot about PRI today. Postural Restoration Institute. I'll leave you kind of. I've done a good bit of PRI stuff, and I have moved away from it a little bit, or probably a lot moved away from it, but not because I think like there's different weird things that people think about PRI and stuff like that. When I say moved away from it, I think maybe like practically on a day-to-day basis moved away from it, but it still has helped me a ton in terms of the principles behind it and just the lens at how I viewed the human body and movement and things like that. Like that has had a massive impact on me. And when I say I moved away from it, like I haven't followed their algorithms or their assessments or things like that. But I think that's where people get confused sometimes with PRI. It's like, okay, you're not necessarily doing the exact exercise from a PRI book or whatever, or the exact assessments. And then they think that PRI is a load of trash because I don't use it anymore. But then when you look at their program, it's like, actually, I think the principles are here. So do you want to give us a little bit of an intro, or not an intro, but like, I suppose in your experience, what PRI means to you or whatever, because I know it can be very complicated.
Yeah, it's definitely complicated. Mm-hmm. And I think that it takes a while to really be able to understand it, and for like in people learning it, we need to know that it's complicated. Mm-hmm. I agree with what you just said, by the way, about people using it and then kind of saying that they're moving away from it, but then they're still using it. Mm-hmm. PRI, in my mind, is ultimately the study of asymmetries of the body, the cortical dominance of the brain, and how we are from a psychological standpoint, and what we do with our bodies and what side we prefer, and then how that relates to our lives, habits, patterns, and then each person is a bit of an individual, but underlying we're very similar. Mm-hmm. So that understanding those asymmetries really lay a groundwork for understanding movement and understanding why we do things in life. So like I said, it's extremely complicated. I think that's a big, we were talking earlier about misconceptions, and we're going to talk about it more. But I think that's a really big misconception about movement in general, is that people always want to simplify it. It's not simple. Mm-hmm. There's no way that our bodies are simple. It's supposed to be complicated. So when PRI goes very deep into many different topics, and I think it can be very difficult to learn, it's not for everybody. But when it comes to treatment and clients or patients that are struggling, some people are not going to get better with just some strength training. Some people are going to need that higher level of understanding why their brain/body is doing these, interesting, whatever their symptoms are. Mm-hmm. So I think that kind of touches a little bit on that.
I think one of the reasons maybe PRI has gotten a bit of flack, well, it's just because it's gotten more popular. And so like that's going to come along with it. The other reason is the name, Postural Restoration Institute.
Yeah.
Posture is like a dirty word now, so that could have been but maybe Ron doesn't care. I don't know, but yeah, that's been an interesting one for me. When you say right side, when you say we're dominant on one side, can you just explain a little bit about that?
Yeah, sure. So
I just gave the game away.
You
there.
gave it away, but that's okay. It doesn't matter. We're going to touch on it anyway. Your brain, your left side of your brain, controls the right side of your body. And as we know, 90% of people are righties. People that are lefties are still going to have a cortical dominance to their right side. Our world is very righty. When you open a door, you're going to open it with your right hand. You're opening a microwave with your right hand. So our world in general, so the habits we form because of our environment are right-sided, how you're driving, etc. But we also inherently have human asymmetry because of the diaphragm on the right side being a lot larger and having a lower insertion point on the right side compared to the left. So it does different things to the right side of the body, pulling it into different positions. And then you have 3 lobes of lung on the right side, only 2 on the left. And then also on your right side, you have your liver, which is on average, maybe like 3 pounds. So we're inherently heavier. The diaphragm's stronger. It's pumping 25,000 times a day, let's say, if you're an athlete. Mm-hmm. So we get this like lateralization to the right side. So even if you're a lefty, your still organs are set up like this. So you're still having a lot of these inherent asymmetries that are happening. And there's really not a problem with asymmetries. The problem is not being asymmetrical. You actually need that to survive in life. The problem really comes down to not being able to manage your asymmetries, or if you've had head injury history or different things in your life, visual history, dental history, etc., that have maybe pulled you too much over to that right side where you have an inability to go back to your left side. Mm-hmm. And that's what I'm doing, is helping people that are struggling with teaching them a part of their brain that they've maybe lost in the process of living. Mm-hmm. So a lot of it comes down to just patterns, lifestyle. We do a ton of behavioral things, and understanding your own self ultimately. Mm-hmm.
I think and a word that PRI use quite a lot is neutrality or neutral. And again, that's another maybe dirty word these days, but correct me now, like I'm not very good at the PRI stuff, right? Yeah. So correct me if I'm wrong, but to me what that word means to PRI is like your ability to move from one side to the other. Yeah. So get onto your left side and get onto your right side, not how well can you stay in the middle. So neutrality doesn't actually mean staying in neutral. It means can you shift relatively evenly to both sides, even though you won't ever be even. No one will ever be even. So neutrality is a thing, and then just get and to me then again, when I try and simplify things in my mind, it's just like having the variability. If someone is like, okay, we know that someone is biased towards their right side. That's not an issue. It's just a fact. It's the way things are. We need to be able to get over onto the left side. It's just about variability. It might be as simple as being able to laterally flex your spine over to the left side. Gives the right side muscles maybe a chance to relax, offload as we load onto our left side. So those are to me those are simple concepts that not simple, but like simplified concepts that do help me in my practice every day, actually knowing this stuff. Why do I always see like a more supinated foot on the right side, even when both feet are very pronated? The right one is a little bit less so. So Ron has been. They aren't PRI. He didn't invent that stuff. That's what some person kind of threw at me one day, that like this is in the research and it's not a PRI thing. And I said, that's fine, but he helped me understand that, how that applies to, I suppose, my clients. So I don't know where I'm going with that, but I think that's a fundamental concept of PRI that has helped me quite a bit.
Yeah, I think what you just talked about is really important. So Ron basically, he's the inventor, the creator of PRI, but what he's done is looked at all this research from years of different professions, dental research, eyes, vision. He's looked at feet. He's looked at it through osteopath information, doctor information, all this stuff of different publications. And he's like put it together because he became so obsessed with the asymmetries when he was in dental school, and probably even prior. I mean, I asked him last week, like, how did you create this? And he was like, I don't even know. I couldn't even tell you.
Yeah.
And so, yeah, when you're assessing, this is why it's very useful information, because as a trainer, as a massage therapist, whoever you are, if you're working with humans, working with the body, to just understand that the person is different right to left. And it could be drastic. It could also not be so drastic. But if you're looking at feet and you notice over and over again, you're seeing the same sort of patterns. Oh, well, maybe there's something to that. There's something to this information. Whether or not you know what to do with it, just understanding and observing, that's the first step. Mm-hmm. And that takes an eye. It takes a time to understand what you're seeing and what you're observing. But definitely just picking up on that is the first kind of step to it. And then other things you kind of just mentioned about just taking the concepts of PRI, which are very complex, and even if you're just a trainer in this field, being able to see it and break it down, utilize it in different ways, that you're always going to help the person in front of you.
Yeah.
You're not going to help the person in front of you if you treat the person as if they're one person instead of they're really two. They have a right and a left. Mm-hmm. So PRI definitely does some very interesting techniques, and I think that makes it stand out because we are reaching with different sides, we're moving jaws in different positions, we're doing funny things with eyeballs, all these different interests, especially when it gets to the cranial stuff.
Yeah.
And I think that it takes time to understand why you're doing it, but if you do have that time to learn it, it can make a really big difference, especially if you're a clinician.
Mm-hmm. The most simple thing that probably most people have learned or used from it is like some of the breathing work, which the explanation as to why it might work is not very simple, but like to do a little bit of breathing work with someone, I do it with most clients in some way, even if it's just like, okay, once a day, it'd be great if you lay down or sat down in a position and just slow down your breathing in through the nose, perhaps out through the mouth, and depending then on like where they maybe need more expansion, you bias them or you put them into a certain position so it gets more chest wall or posterior or lateral or whatever. So like I have found that to be very valuable, and that's been shown in the research, even in like a mindset kind of a thing. Okay, getting people to relax and breathe is going to be helpful. It's been studied for thousands of years in things like yoga and all of this stuff. So so it's there. It's just that I think PRI have tried to maybe dig deeper into the explanations as to why this stuff works, and maybe be a little bit more targeted then with the exercise selection around it.
Oh, totally. I know in the occlusion course, there was information from acupuncturists. Like Ron has just taken information from all different types of sects of knowledge that work with the body, different people. And yoga, breathing is really big. So a lot of what PRI ultimately is understanding that if you bias yourself in a certain position, if you're automatically asymmetrical to one side, you can close off one side, understand to get, let's say, for example, you need right chest wall expansion. If you give yourself left obliques, you're ultimately going to get right chest wall expansion if you're in the right position to do so. And we see that a lot. People need that a lot. So you're giving somebody a little bit of what they need more of. And that can make a really big difference to somebody who, let's say, we're in Manhattan right now. Everybody in the city needs a little bit of parasympathetic. This city is extremely sympathetic. A lot of cities are.
Yeah.
So when I see clients here in the city, they usually leave a session, they're like, oh, I feel so relaxed. Yeah, because you're never breathing. You're never just calming down. And they could do it sitting at their work desk, but of course, putting them in a position that is more beneficial to them, a lot of it's psychology too.
Yeah.
You could do alternate nostril breathing, which is an acupuncture, comes from, I think, years ago, different things like that. You could get somebody neutral with that. I did it last week. And that's fascinating,
Yeah. What do you think is the biggest test for checking if someone is neutral?
I kind of look at it in 3 parts. So I test the pelvis, the adduction drop test, which is really useful for knowing, okay, is the pelvis forward, externally rotated on one or both sides? And if they cannot adduct or abduct, they're not able to bring their pelvis back into more of a neutral position. So neutral, we were talking about it, dirty word, right? But neutral is ultimately a transitional zone. So if I put somebody, if I see somebody standing there on their right leg, that's 50% of your gait cycle. Do you live there 100% of the time? Or are you there 50% of the time? Left stance is another 50%. So you need to be able to do both.
Yeah.
And that's ultimately what I'm trying to achieve. And then when it comes to rib cage, I'm looking at IR and horizontal
of the
abduction.
shoulder.
Yeah.
Yeah.
Because I'm seeing, okay, can this person breathe into their chest walls? Can they do it properly? And then do they have rotation? Can their sternum actually rotate to the right and rotate back to the left? And I'm not talking about spinal rotation. I'm talking about like rib cage. Can you actually, when you're walking, can you rotate? Do you have right trunk rotation? Do you have left trunk rotation? And then for the neck, we're looking at side bend, whatever, lateral flexion, and then rotation. Because if your neck is stuck over on your right side, you're most likely not going to be able to side bend to the right and rotate to the left. So those are, I think of it in like 3 portions. And then you get somebody neutral all 3. That's just like your starting point. That's not even, it's treatment, sure. But it's not getting somebody stronger in that 50% of their gait cycle that they're missing. So ultimately, it always has to go back to how well are they, first of all, symptom reduction, and then how well are they functioning? Can they walk properly? Can they actually, are they getting that trunk rotation both sides? Are they properly standing and keeping their usually left pelvis into a position where it's back instead of externally rotated and forward? And then neck, is the neck going back and forth, side to side? Are they able to, then you get teeth and eyes into the the conversation. As soon as you get to neck, then it goes higher because there's a lot of reasons as to why neck won't be able to go in the frontal plane, nice side to side, and lateralize. Ultimately, it's always back to lateralization. So right side, left side. In order to get to both sides, you have to be able to lateralize.
You want, like, if you break the gait cycle down the most simple way, you want kind of swing and stance. And there's certain characteristics of stance, which is like, okay, I'm adducted, my center of mass is on top of this stance leg. So when you say, okay, you have a right side and a left side, are you living on your right side in the gait cycle? I think people don't understand necessarily what we mean by something like that, which is, of course, you're going to, if you have 2 legs, of course, you're going to put your left leg down. But if you actually take a step back and look at the body, it still looks like it's organized over the right leg. So it still looks, the spine is laterally flexed or side bent to the right. The left leg is not, or the left hip isn't actually adducted. You're not actually over on top of that side. And so many other things. The pelvis might not be rotated to that side. So many things. So that's that. I think when Ron went through that adduction drop test, which I don't use anymore, I look at hip internal and external rotation.
I look at that too.
But I think I see if hip internal rotation, if they have hip internal rotation, I think they can adduct. If they don't, I don't think they can adduct. Because adduction and internal rotation are going to come together.
True.
Yeah. So what will you see on which side will you usually not see adduction on?
Left.
And which side will have less internal rotation?
Left.
Yeah. So that's what
unless
I test.
they're patho.
Yeah. Okay.
That's the only
I think you can see that in lots of other ways though as well.
The patho, yeah. Oh, 100%. You can see it.
And I just don't, the adduction drop test. I think a lot of this stuff for me, when I started looking at people online, I dropped so many of my tests, and then I was
You
like,
can't really do the adduction drop test online.
that's what I mean.
You can't.
So I had to drop it. Yeah.
I don't usually do it online, honestly.
Yeah.
I can look at a person's gait, and at this point, you get enough knowledge, you could be like, oh, I think whether or not they're a PEC or a left AIC, which are just the terms for
Patterns, yeah.
Yeah. PEC would be pelvis is forward and externally rotated on both sides. Left AIC would just be the left side only. Just for people that don't know what PRI is, we're not just throwing terms out there to confuse you. But I think virtually it's very, very hard.
Yeah.
And you can go off symptoms, you can go off history.
Yeah.
But it's just not as clean as
your
when the
standing
person's in
assessments
front of
are great. So your
Oh,
squat,
yeah.
your toe touch, all that stuff.
Awesome.
Excellent. What were you going to say?
I wanted to touch on what you just said about gait, though, because it was really, the way you explained that was really great. How you said your body is organizing when you're standing on one side. Just because you're standing on your left leg does not mean you're in left stance. And that is something that patients and clients, whoever you're working with, will say, oh, well, I stand fine on my left leg. Just because you can stand with your left leg on the ground and right leg off the ground does not mean you're in a proper left stance position. It does not mean your body's organizing well off that left side. And I know you've posted, you'll post pictures of runners and you'll show when somebody's in a better position and when somebody's not. And I think that's a big concept that clinicians maybe at first don't really see, because it takes time to understand that. Just because you have a leg on the ground does not mean your neck is centering over that leg properly. And that's ultimately the goal. It's not to attain neutrality. Sure, that's the starting point. But then it's how well can you get from side to side. And the gait is one of the best assessment tools you have.
Yeah.
Especially, it takes time, though, to learn to look at a gait. It takes a long
Definitely
time
takes
to
time.
develop that
Yeah.
eye, to understand what you're looking at.
Yeah. You need to look at a lot of people. And you need to understand what your tests are telling you about the gait
Yes.
cycle. And I think, the way you're saying there, someone looks like they're in a better position. I think to clarify that a little bit, when I talk about that stuff, I don't talk about pain because they're so separate from each other. Or maybe they are, maybe they aren't, but it's impossible to measure. And the pain science has showed it might not have anything to do with it.
Yeah.
But when you look at the movement world and you take for instance some of the best sprint coaches in the world, they will always talk about posture. They will always talk about position. They will always talk about kind of some level of symmetry, arm swing, stance swing. They will talk about pelvis position, all of this stuff. So I do think this stuff really applies to function. And I do like others, I get frustrated when people just have a biomechanical lens of pain, let's say. And I think sometimes that gets tossed around a little bit, but I think we can still talk about posture and symmetry and position and stuff like that, but maybe take the pain stuff out of that a little bit and say, okay, maybe it's a bit more of an N=1 case when it comes to pain. Let's see what helps the person in front of you rather than just labeling everyone in that way.
Yeah, I mean, ultimately, I have people coming in and I don't know what they're going to present as pain-wise. I have no idea what the person's about to tell me. But it's not that I don't care about their pain. I do. I care that you have back pain. I care that your neck hurts. But I'm looking at you as a whole. I'm looking at what your feet are doing on the ground, regardless of where your issue is. If you come in with neck pain, I'm still looking at your feet. And that's something that takes, time to understand why. And exactly, you can have pain in all different parts. It's not really about the pain. That's just where your weakest kind of link is. I think that's an important thing to know. You could have herniated discs and have no pain.
Yeah, exactly.
And posture too. I want to touch on what you were talking about with posture. It's a dirty word now, but I think we still, let's say regular people that aren't clinicians and people that are learning this stuff still think stick your sternum up in the air when you're squatting. And to me, why? Why are we doing that? And when you understand the biomechanics of how the rib cage should really be oriented and what position we should be in, you can help, even if you're a trainer, you can help your clients in the gym just by knowing simple cues about lifting weights that relate to asymmetries and just overall extension position, or I should say extension posture, and how that can help them in their lives behaviorally. So however you're training somebody in the gym, you're going to either exacerbate their pattern or you're going to somehow make it a little better. I was an Olympic weightlifter for 4 years competitively. I exacerbated my pattern. Big time.
Mm-hmm.
So powerlifters too. But that doesn't mean that you have to stop your sport. You just need a little bit more of what you're kind of lacking.
Mm-hmm.
So,
Or maybe they don't. Maybe they are fine with that.
yeah,
you know
that's
what I
true
mean?
too.
It's but like I think I don't even know if the clients need to know that necessarily, but their coach maybe could have an idea that the more I push them in this direction, the more like certain adaptations are going to happen. Just like if you train a certain muscle, certain adaptations are going to happen. So I think this is where I think like there's never getting dumber is never the answer. Like having more knowledge doesn't mean that you're just going to stop your clients from powerlifting or Olympic lifting or whatever. It just means you have more knowledge and you have more information to make a better decision with, and you can do with whatever you want with that information. But there seems to, like on Instagram, there seems to be this push for like everyone just get dumber, don't get more knowledge because some people apply the knowledge poorly. Don't worry about what people who apply the knowledge poorly do. Get more knowledge and apply it well. That's like, I think that's one of my big things that it does frustrate me when the people shit on biomechanics and all this stuff. It's like, no, you should know about this stuff. You should understand how to assess your client or look at your client. It doesn't mean that you don't train them anymore.
Especially if you work with people. Like if you're working with people, you can be very powerful in their lives. You can influence them in a positive or a negative way. It's your choice. And I mean, like I said, I was an Olympic weightlifter. Just because I don't do that anymore, and that's not what I like to do, doesn't mean that I'm going to push that on a client. I just saw a powerlifter last week. He's competing in a meet. You know, I was asking him all about it. I'm not going to tell him not to compete. I'm just going to tell him how he can get his body to feel better. Do I think that if he lowered his powerlifting, he would also feel better? Sure. But I'm going to give him his tools necessary to feel good. And I definitely agree with you with Instagram is definitely a beast because it can be great for business. It can be wonderful. You can learn so much. I've met so many people through Instagram. But you do have to be careful, and I think there are people that can easily fall into the wrong direction, especially regular people just looking to learn that don't have a background. There's a lot of things out there, you know, people that have 300, 400,000 followers that are posting information that I'm like, this is so beyond incorrect. And you just, where I'm at, I just ignore it. And it's tough, though, because definitely people are paying for sessions with this person, and I'm like, you know, sit up nice and tall, and that's not going to help that person. So it's hard. PRI is, let's say, newer because it's only maybe, I mean, he's been doing it for a long time, but I think it's really gotten out there in the last 10, maybe 15 years. I heard about it probably 6-7 years ago, and it took me time to actually study it. And, you know, I took a course, and then I sat on it for a year. I was like, I can't take this right now.
I know. So
it's tough. It's complex. You know, but I think Instagram can be very positive or very negative in our worlds.
I think one of the big things that I probably took from the first course that I took, which was myokin, which was where you learn like that adduction drop test, which is what everyone is doing anyway, which I think they call it an over test or something, right? But that changed how I viewed assessments because I was like, oh, this assessment isn't just measuring the hip. This is saying, can they get on top of their stance leg? Can they adduct? If you like, abduction is pushing away from a leg. So if someone cannot adduct on the table, then how are they getting on? They're going to find a way, obviously, of getting their center mass on the leg, but in I don't want to say a funny way, but like
faulty.
Yeah, in some kind of a way that's not adduction, at least. So like that changed how I viewed assessments forever. That one assessment, even though I don't use it anymore.
Which is interesting. I mean, you see a lot of people virtual, so I understand why you're not using it.
But I don't use it in person either.
Oh, really?
No, that's what I was saying. That when I stopped using it virtually, and then I think my eyes I'm very confident with my testing now. I'm very, very confident with my testing now. I think my eyes got very good to say, actually, can this person adduct? And I don't need that test to use it most of the time. Now, maybe sometimes it slips through the cracks, but I think I'll still catch it sooner or later.
Well, you know, if somebody I'm small, I'm 4'11", I'm not doing that test on somebody who is a big guy. I can't. So There are certain times where when your eye develops, I can tell if somebody's going to come in. Sometimes it took me a while. I guessed a lot. I was always like, I've been down in Fort Worth for a while. So if I was mentoring under Casey Ratliff, who's a faculty member, and we always would guess, she'd pretty much always be right.
Mm-hmm.
And I'd be like, I think this person's a PEC. And then she'd be like, why? And then, I'd give and she would do the test, and whether or not I'd be right or wrong, it helped me understand.
Yeah.
I did that a lot with PRI.
Yeah.
If you guess before the test actually occurs, or if you're trying to guess different things, I think for me, it helped me learn. But you definitely can tell a lot with somebody's gait. It's what's funny about the Ober's test, or the Adduction Drop Test, is I actually learned it in maybe 2015, or maybe even earlier, in graduate school. And we learn it as a tight IT band, which is how they still teach it in PT schools.
Same, yeah.
And probably occupational therapy, wherever they're teaching it. And, we learn how to do the test, but you're not actually learning anything about the mechanics of what that is doing. You're just saying, oh, the IT band's tight. You need to roll out.
But that's the same with every test you learn.
Yes. And
there's no
yes.
You have a body attached to that hip or that knee.
Or you have a neck attached.
Yeah, exactly.
So it's just, maybe PRI is on this new forefront of knowledge, and they're really pushing the newer research out there because they're a private organization. But schools are much more behind. So you, as a new clinician coming out there, it's hard to let go of what you've learned in school and find the newer stuff that's actually going to benefit the person in front of you. But you do have to remember that what you learned in school is probably 30 years old. So that's kind of a tough pill to swallow when you get out of school. Or it's a learning curve. Like I did so many things right when I got out of school just to learn more, because I felt like what I had learned in graduate school was just not cutting it for people. And then eventually it took me like 2 years after school, I started to study PRI, which is early for a lot of people.
Yeah. I think, look, most people, I don't know the percentages, but like pain-wise, most people, a large majority of people, I think, get better.
Yeah.
And would get better with time anyway. And like, just if anyone is promoting some, even sometimes I see, I had a guy on my podcast, Dr. Peter Maliaris. He's a tendon researcher,
cool.
Very, very smart guy, really, really, really good guy. But even he was saying they're doing some research at the moment. I think it was with the Achilles with regards to like, is exercise the thing that we should be using? Even though it's helping, would it be better to do, I can't remember, it could have been like shockwave or some manual therapy or something like that. And I just found it interesting, his point of view, how he was he was thinking about this, when in my mind I'm like, I don't really care if shockwave is going to be better for it. I want to promote movement, because like in a year's time I want them to be stronger, and I want them to feel, I want them to, all the benefits that come along with that, their heart, their lungs, their mental health. So from the research point of view, I just found that very interesting when he said that. I didn't mention that on the podcast at the time. Yeah,
and for me, my first question would be like, well, what side are we talking about? Because to me, if it's a right Achilles, it's going to be different than a left Achilles. I'm going to think about it in my brain differently.
How would you think about it?
So if, let's say it's left, and I have a client actually tore his left Achilles, and you're pushing off always on that left leg to be able to get to your right leg. We see that more often. We're easily able to get our right heel. We're easily able to ground better into that right side because we're always on that right side. So we get a lot of push off. Like you'll look at people's shoes, and the front tread of the left shoe is more.
So they're later in the gait cycle on the left side. They're pushing towards their forefoot much sooner. Even if they heel strike, they're still kind of racing towards their toes on the left side. Exactly.
You worded that so well. And so to me, that left Achilles is always pushing. Whereas the right one, and it depends, maybe you have somebody that really grounds into that right side. They can't get off of it. They're never getting to the left side. So their left side's always assisting the gait cycle to get to right stance. So right versus left, it's different. Also, left-sided injuries, I think of differently in general. I'm thinking more compensatory versus just a positional issue. Right-sided stuff is more like, we need to just get you out of being in your right side. Left side is like, okay, well, you got to your left side somehow, and we don't know how. It's kind of faulty. So that is interesting, though. Tendon stuff, to me, also is like, oh, well, if it's tendon, it's related to a tendon. It's gone a little bit far if they're having some problems there. So, yeah.
I think about it differently in terms of getting off the right side and getting onto the left side. Maybe not, but I like to. I just think people can't get onto either side very well.
Sometimes.
Yeah.
I was like that.
Yeah.
For sure.
Yeah.
A lot of times you're going to see people that, like your PECs, where they're forward in both pelvises, or cranium people, like people that have stuff going on up here. They're going to have a hard time. They'll like waddle side to side.
Yeah.
And they're not really ever.
They don't shift
At all.
Yeah.
They're just figuring out a way to just kind of duck walk side to side. Gymnasts are a great example, powerlifters, weightlifters. Whereas you have a baseball player who's not really going to be like that. They're going to be more your typical left AIC pattern because their sport is more asymmetrical.
But PRI might say that a right foot usually struggles not with pronation, right?
Yeah, like right arch.
Yeah, so the right medial arch coming down towards the floor. Why then? Because I would see pronation as stance.
Technically, it's mid stance.
Mid stance.
Right.
So where if someone is much more supinated on the right side, where are they? They're not in mid stance on the right side. They're earlier.
Yeah. You would be technically in like more late stance on your left and early stance on your right.
Yeah.
But you have to think of it too as like the whole body lateralization is to the right.
So
it's
over
like
the
they're
outside
falling
of the right foot.
out. Yeah, they're falling out. So they're all the way to the right. That's why they're supinated on that right side. And they can't go back to the left.
That's why I think
Same thing.
I need to I usually like to teach people to get onto the right side and the left side.
You have to train the right side too.
Because I think they can't get into mid stance on the right side either.
I agree. 100%. That's why there's like certain right glute exercises to help you learn how to push off of your right leg, use your right arch, use your big toe, push off, get to the left side. So you have to treat both sides. That's a very important muscle too, PRI.
The right glute.
Yeah.
Yeah.
For that reason.
But that's still a pushing off muscle, not
Yes.
a loading in.
True. Well, both.
Yeah. It depends how you do it.
Depends on the technique you're using, etc.
Yeah. So when you think about the feet, the Achilles stuff is actually interesting. When you think about feet and Achilles, like what, and especially on the sensory side of things, because you mentioned feet, if you're treating a neck client, you'll look at feet as well.
Yeah.
So what way do you think about feet then?
So let's go back to the Achilles because I like that example. So let's say they're having left-sided versus right-sided versus both. What if they're having pain on both sides? Then I know they're probably very extended. Their rib cage is elevated on maybe both sides, maybe more on the left because I see that a lot because of the right diaphragm pulling you over to the left. And I know, not even thinking about neck, I just know pelvis might be forward on both sides. I know if I treat above the feet are going to fall into the correct position. If we get ribs back, pelvis able to come under, femurs able to adduct and abduct properly, then feet are eventually going to go along with the pattern that I'm putting the person in. But also shoes are a really big thing with PRI. And I think we did a podcast. I have my podcast, right? And I did it with Lori, who makes the shoe list. And I had her talk a little bit about it. But if somebody came to me with any pain ultimately, but Achilles, I would be very strong with the shoe list. I'd be like, you got to get a new pair of shoes. They come to me usually in like a Nike. I'm like, Nikes are terrible. I straight up tell them, I'm like, we got to get you in a better pair of shoes because shoes, especially if you're walking in a city, flat ground, flat apartment, not in an uneven surface. If you're walking outside in the grass, cool. In the sand, cool. I love it. Do that. But most of the day, we're not cavemen. We're not walking on uneven surfaces most of the day. So if their foot can pronate and supinate better in a shoe, then I know that the next session they come in for me, they're probably going to have some symptom reduction. At least that's the goal. So I'm looking more above the chain because usually those people that are coming to me with like an Achilles pain, they've seen other people for it. Yeah. They've done treatments.
Yeah. You're kind of ticking off like, okay, you can do 10 calf raises here.
Yeah.
Yeah.
Like they can do that.
Yeah.
That's for sure. Do whatever you want.
Yeah. Why would a shoe help someone's foot? Why would a different shoe help someone pronate and supinate better?
Yeah, so let's talk about the PRI shoe list and why they make it the way they do versus like a Nike. So video is good for this because you could like show it, but I'm going to explain it as best I can verbally. So when you're looking at a Nike and you kind of squeeze the back end of a Nike, which is called the heel counter, that part will just come together very easily, and you can probably fold that whole part down, or
just smush it together.
Yeah. Or even like the barefoot shoes.
Yeah.
Really great example. I have a couple pairs at home from a few years ago when I was wearing them, and I had chronic heel pain. Cool. So those shoes kind of roll in, and I understand the purpose of them. They're to make you feel barefoot. However, we do not walk on uneven surfaces anymore. We walk on only flat surfaces. So our foot, when we're walking on a flat surface, it's not about forcing an arch or getting it to forcefully pronate. It's about just giving it the sense. It's a sensation to your brain to say, okay, there's something underneath my arch, so I'm going to feel that, and my brain will feel comfortable and safe pronating into it. Yeah. So I kind of talked about the heel counter, but then I went into the arch, but I'll go back to the heel counter now. Yeah. The heel counter, you have a talus, right? I'm sure you've talked about it, or talus, however people like to call it.
I would say talus.
Talus, yeah.
Well, I could, one episode or one video could say talus, next I could say talus. I'm all over the place with my pronunciations.
I think I call it talus, but I don't know. So the talus has no muscular attachments to it. It is sitting right on top of the, I just kind of punched the mic by accident. So if you heard that, sorry. It's sitting right on top of your calcaneus. And so what the heel counter does is kind of give the calcaneus a bit of a hug so it can move and it can assist the talus bone to be in a better position for you to be able to pronate and supinate. Yeah. So the midfoot can work better when you have a hug around the calcaneus. Yeah. So that's ultimately the reason. There's like a few reasons. Those are the main two reasons that we like shoes. Now, Lori Thompson, she's a faculty member from PRI. Every, I think, 6 months, she makes a new shoe list. And they just have the better shoes that she feels that are like sneakers, which whatever, some people call them tennis shoes. I'm from the East Coast. I call them sneakers.
We call them runners.
Okay, runners.
Even if you're not running in them, they're runners.
I'm not running in them.
Yeah.
But those, the sneakers, those are just the ones that she looks at. But I've actually asked her questions about like more dress shoes for girls, what she thinks, because they give you on the website, the second page is how to test your shoes. So it doesn't have to be on the shoe list, but there are certain requirements that will make a better shoe. Yeah. So versus like a Converse, which is like super, super flat. Yeah. No arch, no heel counter.
I think when most people think of shoes or they've been told to get a better shoe or a different shoe, it's about blocking movement.
Yes.
So you go into a lot of running stores or whatever, and they'll build an orthotic, or they'll put you in a different shoe to block pronation.
Right.
Usually.
Yeah.
I've seen clients with
so much.
Like the arches so high you could drive a bus under them, and they've still been told you need to block pronation because they put them on some walking treadmill and they see a little bit of pronation and they say pronation is bad, let's block it. So but I think PRI's view maybe is if I can have a shoe or something touching the arch and hugging the heel bone, it's actually like it's like a torch shining a light on this area so the brain can sense it, and when the brain can sense something, it can move into that area. Just like an injury to a knee joint or anything, any old injury, you would typically see like proprioception around that area is really, really poor. It's like the brain has like closed it off and said, okay, well, sometimes it's closed it off, sometimes it's become hypersensitive to it, but it's like, okay, we're just not going to go there anymore. Right. And that's where the awareness and stuff, the sensory stuff can come in. And you just see like people's eyes getting opened and they actually have access to all this information flooding in, especially when it comes to the feet, because there's so much information coming in through there.
So much. Your feet are extremely important. They're your ground sense. It's very, very important how you can connect to feeling grounded. And people think, oh, if I'm putting a bulky shoe on, I'm not going to feel grounded. It's not about stripping. The more you're stripping off your feet to feel the ground, the less you can actually sense the ground. But I love barefoot outside walking. I think that's great. I think we need that. I think we need different things to allow our feet to move into different positions. But we have to understand that we are not walking on uneven surfaces the majority of the time. You've been in Manhattan all week. You see there's cobblestone, but it's ultimately flat concrete you know? And I think a big thing that's tough with this to fully grasp is that it's neurology. It's your brain sense. It's not about forcing the foot into any position. I take those hard orthotics out faster than anything. Like those can really wreck a PRI program because, or in general, a program just to get somebody to feel better. If they're in a hard orthotic that's stopping pronation, they're never going to get to the other side of their body. They're never going to be able to find that mid stance and push off properly because they have a foot that's stuck in supination, which is fine. It's a part of the gait cycle, but you have to be able to do all movements of your gait cycle.
Yeah.
And, barefoot shoes are a big thing, which I get the purpose, but I think we have to like try and push out that there's other reasons as to why we would use a shoe.
Yeah.
It's not about necessarily being barefoot, although being barefoot is great.
Yeah, it's just information. Yeah.
Yes, and it's understanding. Your brain needs to understand it. Yeah. You can't tell your brain, oh, I'm going to pronate here, unless you're working actively on something.
Yeah.
When you're walking, you're not going to.
No, and you don't want to. Like the amount of times I've had to tell people to stop trying to get something to happen while they walk.
Yeah, no.
It's just, it becomes neurotic. I've been down that road myself. It's not a good road to go down.
No, you want it to happen naturally with you not thinking about it. That's like anything with movement. I mean, I don't need you to force yourself to have an arm swing.
Yeah.
You should naturally have an arm swing because the arm swing is going to tell me how well you're going to the other side, to the left. And if you don't have that arm swing, your right arm is stuck to your side. I know you're not getting off your right leg. So whether it's stemming from the foot or the cranium. I think also an interesting part too is, let's say I'm working with somebody, they get new shoes, they don't feel any different. One, there could be that they are what we call more incorporeal, which is they talk about in the I&I course, which is like they don't sense their body well. Yeah. Some people just don't sense their body well. I'm not exactly sure why. They just don't have that connection.
Yeah.
I notice certain professions, and they talk about it too, like lawyers or accountants, people that work with more like numbers or more abstract things, they might not sense their body as well as somebody like me or you who work with people. Obviously we do because we're in the movement profession, but those people might not feel a difference when they get a new pair of shoes. And then people that are locked up in the cranium, like when I personally got shoes, I was like, oh, these are cool, I feel better, but it wasn't like,
yeah.
And then some people are like, wow, these are amazing, I'm never getting out of them, I love them so much. And those people, wow, these shoes are really impacting them.
Yeah.
So that's hard for people virtually. If you're working with somebody virtually, you get them in a good pair of shoes and they're like, don't really feel a difference.
Yeah.
So that's tough. So.
Yeah. I'll usually re-educate the feet. I'll usually get the feet moving.
Yeah.
In a slightly different way. I think PRI are more about like, there's a lot of isometrics there. There's a lot of kind of pushing into the arch and stuff like that. I like to teach people how to transition from early to middle and back again, over and over and over again. And they get that sense of the heel actually pressurizing, then the midfoot pressurizing on the floor. One thing I will say, you don't need to comment on this if you don't want to, because this is a little bit of a knock maybe on not necessarily PRI, because there's any system or whatever, right? There's going to be like practitioners and stuff like that, and what one practitioner does shouldn't necessarily be a knock on like everything, but and this is a really good practitioner, a really good guy, I won't mention his name, but I had a client recently who was with this guy for 8 sessions. He flew to him. Wow. And he had a toe problem. Okay. The only time he took off his shoes to look at his feet were to put on another pair of shoes that were on the PRI shoe list. You gotta actually look at what's going on. Like I would feel the heels, I would see what's going on. He took off his shoes to put on his other shoes, and he got him to buy 3 of these pairs of shoes so that he could have a like when I'm going for a walk or a run pair, indoor pair, and then something else. Maybe he was like telling him to sleep in them or something. I did, this guy was like struggling. He was at 1,000 steps a day with sesamoid pain all of the time. I did one session. We did a pronation drill where I actually just transitioned him. He was on his right side, so he couldn't pronate, but he couldn't pronate well. But the way I look at it is, on the right side, they still need to learn heel pressure. Yeah. Because to get your midfoot to, I think of pronation. I think Ron might think of pronation as the medial arch coming closer to the floor. I think of pronation as the joints on the plantar surface of the foot opening. Yes, flattening out. And you cannot get the joints on the plantar surface of the foot to open if you press your medial arch down. Because you need pressure on the lateral arch as well to actually get all of the joints to open.
Yeah.
So you need good heel pressure on the right side, and you need to teach the calcaneus on the right side and the left side to posterior tilt or plantar flex down. Or sorry, not posterior tilt, to anterior tilt, plantar flex down. Yeah. So the treatment that this guy got was new shoes, press your arch into the shoe. The treatment that I gave him was, here's how you actually plantar flex your calcaneus and get your midfoot pressure. And he did that drill, and he was able to do 10,000 steps every day going forward.
Yeah, and sometimes you need to break it down for people, for sure. Sometimes, and very specific, like just a toe, one toe issue. Like I would, first off, you definitely have to look at the foot.
Yeah,
and see what's going on.
Yeah.
I'm glad that he feels better.
Yeah, I know. It's just
that just goes to show that there's lots of modalities can always help.
Yeah.
Most people are going to feel better just with certain different things. It just depends on the person too.
Exactly.
Depends on the clinician too. Like, can you connect with that client? Like, not every client is for that person.
I think that I like the Occam's razor thing, which is, even though we know the body is so connected and all of this stuff, and there's no isolation necessarily.
Yeah.
You have to look at the area where they have pain still, even though I'm not going to just, someone has a knee joint issue or whatever, a foot issue. Like, the first place I'm going to go is to that area to have a look, even though I know I might need to do something with their neck here.
Yeah.
You still have to be like, okay, I'm going to have a look, because actually maybe the simplest solution is actually relevant here.
That's true too. You definitely have to look at what they're coming in for. I always do, so I, of course, ask them. I'm deep in history. I ask a lot of questions about history. My form online, I ask tons of questions. And, that leads me into what I'm going to do with the person. And it was interesting. I just watched Ron all week last week. He came down to Texas and talked to a few of us, saw some patients. And the way he treats is fascinating. And it really helped me understand that it's so much about your aura too, and how you are presenting yourself to that person and what you're seeing. But history is big. And you definitely need to look at what the problem is. But you can the complicated cases, you're going to be surprised, because a lot of times it might be vision or something like that, which takes a very long time to be able to understand. I mean, I'm just starting, my tippy toes are in there right now in the cranium stuff. I am fascinated by it, and I really enjoy it, and I've talked to dentists about it, etc., eye doctors, but tippy toes just started to understand that because it's so in depth. But you still have to look at the area. That's what they're coming to you for. Yeah. So, and that's what they're paying for.
Yeah, exactly. So someone comes into you, right? Let's say me.
Okay.
And regardless of what the issue is, but what leads you down the path of thinking, okay, I need to look at teeth or get someone else involved. How can you even explain that to, not necessarily your client, because that would be different. How can you explain that to the people that are listening? Sure. Why teeth are important? Why the eyes are important?
Yeah.
How, when you're saying about the lateralization, how come the neck is so important?
Yeah.
Because for me, very briefly, when I see someone with, regardless of the issue is, and they also tell me they have their neck is really tight, that's a big ding 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 in my mind that I need to clean up this neck.
Yeah.
And it's usually the one thing, aside from the eyes and stuff, right? But it's usually the one part of the body where I will find it will get in the way of pretty much everything else if the neck is just tight all of the time.
Stubborn, right?
Yeah, try and clean that. I almost always try and clean that up. Even if it's okay, someone has a foot issue. Okay, here's 2 or 3 foot exercises. Plus, do this exercise for me.
Yeah.
Just because you have a tight neck. I won't even mention that it's related or whatever, or might be related. It's just I just want to clean this up. It'd be great if your neck wasn't as tight.
Yeah.
And I'm just kind of trying to sneak it in some of the time.
Yeah, well, it's good. It's good to be looking at it. That's how you learn, and that's how you grow. I want to attribute this answer to Casey, who's in Fort Worth, and I've been down there for the last year and a half. And
what's the name of the clinic?
Prism.
Cool.
Which is funny because it's
PRI.
Yeah, well.
SM, is it?
Well, no, it's. I think it's I don't exactly know. It's Postural. I don't know.
How do you spell it?
PRISM.
Yeah.
But what's funny is that when you can work with people with, there's different glasses called prisms, and they kind of can change your proprioception, can change your spatial awareness. So I love the name. I think it's cool. But I've been down there working with her, learning from her, and I wouldn't be able to answer a lot of these questions if she didn't mentor me. So that's one thing, because I, a few years ago, did not know any of this stuff, but I have really been able to mentor, learn from her and what she's been doing down there, which has been a game changer for me. And I'm so grateful for it.
Yeah, that's why I like having these conversations, and I'm like, I don't know a whole lot about this, definitely. I know very, very, very little, apart from mostly my experiences with this stuff, which has been like concussions and eye issues and cranium stuff and all that. So like, whether it applies to a lot of my clients or not, I don't know. Well, it applies to every single person in the world, like how you view the world and all that stuff.
Yeah, we all got eyes and teeth, hopefully.
Yeah, so it obviously applies, but I just want to learn about this stuff, you know.
And it's great because we can spread it on here, which is it's a great platform to do so. But yeah, so you're kind of asking, like, how does that feed into?
Yeah, like how would you start to think? Firstly, like the teeth, because I know I've done courses and stuff where Ron has talked about the teeth and the feet, the heels, the eyes, like how all that stuff is so related. Obviously it's related, but why it's so important, and like what makes you think, okay, this client, maybe I need to dig a little bit deeper here.
So if somebody comes into me, and a lot of this I've learned from her, I don't really mention it on the first session or really the second session. It's not, I might be thinking about it, just dependent on the person. So like, for example, I had a guy the other day, very big overbite. So it's in my mind because I see that it's not what we like in a bite. I want you to be, let's talk about teeth first. I want you to be able to sense, your brain to sense your canines, because your canines allow your cranium to move in the frontal plane, which we need our neck to be able to do that. So canines allow your neck to stay free. And actually, Ron just did a webinar like a few days ago, and he talked big time about the canines. And I thought that it was very useful information because that is very important. So a lot of people are missing one canine, depending on the person. It's not that they might not actually touch, but they also don't sense it in their brain. It's kind of like the feet. You have to sense these things with your brain. So canines allow your neck to be able to do that, which helps your body transition, lateralize, side to side. Molar sensation allows for you to ground back into your heels versus being up on your toes and lifted up and extended. So being able to sense that in your bite can make a really big difference, you know, in somebody's pain.
So people listening now, can you walk them through like biting down and seeing what they can feel?
What I do when somebody comes into me, I just say, can I see your normal bite? I have them smile and I just look, do I see canines touching? Sometimes I have them pull their cheek back and I see there's different classes of bites. You know, dentists obviously know way more about this than I do. But in the occlusion course, they really teach you what class 1, class 2, class 3 kind of look like. And also from my own experience, I know, because I know what my bite looks like, because I'm pretty asymmetrical. I should post it again on my page, because a lot of people are. You might see a class 1 on one side, class 2 on the other side. So how the teeth are lining up. Are they lining up directly on top of each other? Are they fitting nicely in the grooves? The ultimate ideal situation is to have class 1 on both sides, but that is not always what we see. So I look at it, and then if I am working with somebody, I look at it all on the first session. You know, that's why my first session is like about an hour, 20, 30 minutes, because it's just very hard to get it all in. So I want to look at everything the first session. I take notes. I give them techniques, sometimes addressing cranium, not usually.
Do you ask them to bite down and ask them what they feel?
I do ask them what they're feeling. So I say, like, what do you sense? Which is a very hard question. Yeah. If you've never tried it before.
About it, especially with teeth and feet as well, actually.
For sure.
The issue I find with that is, not with the teeth, I don't ask that question. The odd time I will. Yeah. But with feet, I don't trust them. Because I've seen people say, I can sense this very, very well. Or like, I'm really heavy in X position. I'm like, no, you're fucking not. You are. In my head, I'm like that. Like
Yeah.
I've had people in front of me and they're like, yeah, I can feel all my weight in my first metatarsal
And
on
you're looking at
X
it.
foot, and I'm like,
It's lifted off the ground.
I can pick it off the ground. I can put my finger under there. So maybe that's those people that you're talking about that just don't sense their body very well.
Yeah, you have to go with what you're seeing, but also what they feel.
Yeah, you have to. It's information that they're like telling you something,
Yeah.
and actually it's like that's not the fucking case at all.
Yeah, and then, with teeth, sometimes you could do a technique that gets the body in a better position and the sense will change.
Yeah.
So that's an interesting thing too. So if I do a cranium technique, I ask them, do you feel different in your bite? And they'll bite. They'll be like, oh, maybe.
Yeah.
So depending on the person.
Yeah.
So that I do look at it on the first session.
Yeah.
Most of the time, unless, no, I always look at it.
And
now.
what with like the asymmetry favoring the right side, what would people typically say that they sense then?
You'll see a lot of times that asymmetrical person will feel their left canine and right molars, or they'll just feel their right molars.
Yeah.
Just depends.
Yeah. And that similar to the pelvis rotating to the right then?
Kind of, yeah. That's technically right stance.
That's right stance as well. Yeah.
In your bite.
Yeah.
I just like bit down, like I did my bite to no because mine is like that. So, but yeah, so what we will do, let's say they come in for a second session and they're not neutral at the neck, they're neutral at the pelvis, their rib cage is okay.
Mm-hmm.
I'll update their techniques. Maybe I didn't treat them for their cranium yet. Then I'll treat them for their cranium.
Mm-hmm.
And then they come in for a third.
What does that look like? Treat them for their cranium.
So you use
cranium.
Yeah, sure. I'll use the PRI techniques that they have a few. It will depend on the person, of course.
Yeah.
So if the person has had head injuries, I might go into a different way of treating them. I'll treat them for torsion patterning versus what we call right TMCC. But that's where it gets more specific. So underlying, I love to kind of explain it like this. There is skin, and then there are people with skin and tattoos. So skin, we all got. So most of us are all patterned. Some more than others. Mm-hmm. But then some people have tattoos. Those people that have had 2 head injuries, have had maybe 2 rounds of braces. Mm-hmm. Those people might have some tattoos. So you have to...
I have some tattoos.
So do I.
I've had 7 concussions.
Yeah.
So, yeah.
So that'll get you.
Yeah, we'll get you. Trust me.
That's
why, like, when people on Instagram and stuff say that this stuff is bullshit.
Yeah.
I'm like, you haven't felt it. If you felt this in your body,
yes,
you would not say that.
That's a big thing too, because the people that are saying that have never been treated properly.
Yeah.
Because maybe they have had a few concussions, but they've only done the pelvis stuff. It's not going to help you.
Yeah, it will not help.
And
you.
I know from experience as well, because I also had about 2, maybe 3 head injuries.
Yeah.
So I totally get it. Which, actually, as a clinician, it's helped me. A little bit of a struggle, but it's definitely helped me understand what the person's coming in, and they can't get better, but nobody's looked at their cranium, whether it's whatever, right hip pain. So then by, let's say, the 3rd session, then now I've started to develop a team here in New York with a dentist, Dr. Peltz, and there's some other clinicians here. And I do have an eye doctor that I've sent people to. Yet I haven't really I've worked with her with about 5 people at this point, sending people to her, but I have not gone to her office with a client yet. Mm-hmm. I'm not really there yet with my vision knowledge, so I'm not really comfortable. I'm just letting her. She's great, and Rua works with her as well. He's another clinician here in New York, so I trust her, and she's done some really good stuff with the patients I've sent her. And then the dentist I'm going to be working with about 2 to 3 cases. But I've done some work with dentists in Fort Worth, and I've watched so many different treatments with Casey's and her working with dentists there. But then by the, let's say, 3rd or 4th session, if they are still coming in not neutral and they are not able to hold whatever techniques I'm giving them, then if I think the driver is dental, which you'll kind of know at that point, although it is hard to know sometimes if they have vision and dental stuff going on. It's kind of like, well, for me at this point, I'm still assuming like, okay, this is what I think is going to work best. I'm not always 100%, but I'm learning, then I'll have them go to a dentist. They'll do a mold for them or whatever they do, a scan. Usually that we like the molds better. I learned last week with Ron. The scan's not as great, but they'll make them a mandibular appliance that they sleep in. So that means it clips in to the bottom teeth. I have one myself. Dr. Lecca in Fort Worth made it for me. Yep. or he's in Dallas, and you clip it in, and what it does is allows the jaw to move freely side to side. Because if your teeth are keeping you locked up, the neck is not going to stay free.
Yeah.
So for some people, if that is their issue, then that can make all the difference for them. It just depends on if that's their issue.
Do you only wear it when you're sleeping?
Only when I'm sleeping. You can wear it when you're doing PRI techniques, but I just don't. Or when you go on a walk.
Yeah.
At this point, I just wear it when I sleep.
Yeah.
And I
But your clients, you would usually only say, you would say when you're asleep or when you're doing your techniques.
Anything upright, where you're moving through space upright, walking.
You can wear it then. Yeah.
But you don't want to wear it 24/7.
Yeah.
So,
and when you take it off, then is your body like?
It's senses. So
Yeah.
you're keeping the sense. It's
Yeah.
kind of like a shoe. Like you're giving your brain the sense of it being able to feel and move the jaw side to side in the frontal plane better, so that when you're doing your day without it, then you can still sense it. So, for example, for me, I used to only feel my left canine and right molars. I could never feel anything else. Now I feel both my canines and my right molars. I don't think I'll ever feel my left molars, but
That's exactly what I feel right now.
yeah.
Right now, you can probably see that, but yeah, that's what I feel.
Yeah, and a lot of people, it's pretty common.
But my jaw shifts around a lot.
Yeah.
Tons.
And probably because you've also we're experimenters, we're scientists with our body. We're gonna try different things. And it can change with different techniques too. So that's like the interesting thing. So that's kind of like how it would work if I was treating somebody and I suspected dental. But I've been in New York for a few months now, or like a month actually, not a few months, but I'll be here for another maybe about a month and a half. So I have a couple more cases that I'm going to work with Dr. Peltz with, just experience-wise. So, because it takes time to be able to get there and to find a dentist that is open and interested. She's really interested. So it will be great. She's met Ron. She's done a case with Ron. So I'm excited for it.
That's cool.
Yeah, it's really, really great because the city, there's a lot of opportunities here.
Yeah.
But when it comes to vision, it's much, much more difficult, I think. Although neurooptometrists, because of their learning, they already know that the eyes are part of the brain.
Yeah.
Whereas dentists, some of them are kind of like, well, why does this matter?
Yeah. Yeah. The eyes are the brain,
Yeah.
whereas the teeth are they think the teeth are the teeth. That's
Right.
it.
And
Or not they, but some of
a
them.
lot of
Yeah,
them.
yeah.
They're concerned about airway.
Yeah,
So
yeah.
airway is like a big buzzword right now, which
Yeah.
is great because I think they're starting to realize that it can affect posture, forward head, or whatever,
Well, I think a lot of their
straight neck posture.
best practices have changed quite a bit because a lot of people,
Big time.
their airways got fucked up.
Oh, yeah, big time. I mean, from when me and you were kids, like dental stuff is completely different. It's it's a different ball game.
Yeah.
Back then they were just like, here, throw braces on.
Yeah.
We don't really know what we're
looks
doing.
good.
Here,
Yeah.
perfect.
Same as the orthotic.
Yeah.
Looks good. Your feet are nice and
Stuck
whatever.
in this position.
Exactly.
Same thing.
No movement.
So, yeah, I think there's definitely a push with dentists learning a lot, but I think it is hard we're changing the way people are looking at this with PRI at least. Like me and Dr. Peltz talked, and I told her, like, we're going to do this person upright for whenever I see this client with her, and she's open to it. We're going to fit the guard standing because you do not, when you're laying down in a dental chair, your neck is in a different position than when you are standing. Yeah. So, so there's different intricacies of
So
the
she'll take the
treatment.
mold.
No, she'll take the mold how she takes the mold.
Yeah.
I'm gonna put towels underneath my client's neck to keep the 30-degree lordosis, and then I think she does a scan actually, which, I mean, I don't know enough about it, but I'm just gonna go with it. She'll do the adjustment about like 10 days later, 15 days later, etc. Standing, and I'm gonna come to that appointment, and that I've done before in Fort Worth. So Fort Worth really, like, Casey has established a big thing down there because there's a lot of clinicians down there, PRCs and dentists, like about 3 in the area that are open, maybe 4 even, because there's a newer one who's learning. So, I mean, and she has eye doctors down there. So it's very cool what she's doing down there. Yeah. And of course, PRI has Prime. They have a Prime program where you would go and, if you're really struggling, and you would get to see all their clinicians there too, which is ultimately that's how healthcare should be. You're one person head to toe. Yeah. Can't just specialize and look at the shoulder and that's it. No, because the shoulder's connected to your neck, which is connected to your sternum, which there's a lot of things involved. So I think that's where healthcare needs to go. it just might take time because now we have a lot of specialists in our world. So that's kind of like how my practice and way of looking at movement is going. But it just depends on the person. If they're skin or tattoos.
Yeah.
That's a good way to describe it, I think.
It's a great way.
Yeah.
Yeah, it's a great way. Like I've learned a lot of this stuff just through my own body, like, and felt it. So I think I can understand why some people like just kind of laugh at it or whatever, because maybe I would have done the same if I hadn't felt it.
Yeah.
You know, if I hadn't felt like the days when my neck feels good, my body feels amazing. The days when my neck feels shit, like that day, doesn't matter what I do.
Yeah, so I was just saying about how Ron came down to Texas last week. So we were in a pretty small room, not not this small, but it was not huge. It was like a gray wall color, and I was sitting about how I am now on the left side of the room if you're looking at the room, and I was turned my head looking to the left. And then at the end of the day, I felt terrible. And I was like, went on a walk and I felt so much better. Like different human.
Yeah.
My neck was so tight. I don't usually get like that because I'm not usually sitting for 7 hours straight. I loved it. I learned so much. I'm so glad. I'm glad I went on a walk later on in the day because I was stuck in a position where I was actually in the pattern and just exacerbating my pattern. Looking to the left, head rotating to the left in a
sitting on your right
side
butt
bend, sitting on my right side.
Yeah.
Crunched into my right ab wall.
Yeah.
So, I mean, I'm going to learn better probably because I'm very comfortable. That is my home base. I'm great right there.
Yeah.
But I really felt it afterwards. And then, I know myself at this point. I've been studying this for a while. I think I just did like a simple technique, one pelvis technique, and I went on a walk. And different human. So it's cool because knowledge gives you power to do these things.
I think I heard... I don't want to butcher this now, but I was on a course with Ron before, and he mentioned about his office setup and his home setup.
Yeah, I know what you're about to say.
I think his office setup is like he sits right beside the right wall, and then all the spaces to the left side of him. Is that right?
Probably.
For his left peripheral vision,
Probably.
so that his eyes, not so his turn his neck necessarily to the left, but so his eyes are looking to the left.
Just to see something. I'll tell patients, like if they're having, let's say they work in a cubicle, I'll tell them to put like hot pink Post-its up on the left wall. Something, or like flowers. I told somebody once, she's like, I have flowers. I was like, perfect.
Yeah.
Put some flowers up by your left side just to change your scenery a little so when you're looking straight at your computer, you also see that.
Yes, you notice it. Yeah.
That's like a vision thing. That's a peripheral. It's important.
Yeah. Like this stuff for me has helped me massively with my clients who aren't cranial clients or aren't, I think I just want to reiterate that, or iterate it maybe in the first place to people who are listening, where like it has helped me understand why some people when they walk in nature feel great and when they walk in the city they don't. It never helps them. Like going for a walk out in nature, and I encourage people to do that way more. It has helped me understand like how important the shoes they are wearing or how their feet are actually move. It has helped me understand that. It also has helped me, if I am coaching a breathing drill, which side of a client I stand on.
Oh, big time.
Things like that.
I think about that a lot.
Yeah.
That
so I don't have to
time.
talk about the eyes or the ears or the senses.
Yeah.
I just stand in a position, and it does change what they feel.
Yeah.
And how they move afterwards.
Yep. What you were talking about in nature, which is really interesting. I had a case of a client. She's so sweet. She was having neck pain, but only when she ran on the treadmill. And to me, nothing is passing your vision when you're running on the treadmill.
Yeah.
So we're supposed to be walking. We're like catching ourselves as we walk. You have arm swing that allows you to get from side to side. Your vision as you're walking forward, things are passing you.
Yeah.
She didn't have it when she was running, right?
Yeah.
She was running. So I told her just run outside, and she never even put two and two together, which is why I'm there to help put those links together. And that neck pain went away. I gave her techniques, and that also helped too. But it was very interesting to me because that is a visual system that is just not working optimally because you're walking like a hamster in one place.
Yeah.
We're not meant to do that.
Optic flow.
Big time. So, nature is really, really big. And I see a lot of clients or patients, whatever I want to call them, here in the city, and they are in different positions than I usually see in Texas. And I always find that interesting. Or if you go to LA, you're going to see more patho, you're going to see more compensatory issues versus in a quieter place where there's more surroundings. You can go outside. In New York City, what you have Central Park, but people aren't necessarily going there every day. They're working, they're stressed.
Yeah.
So it just goes to show your environment really affects you.
Yeah, massively.
Big time. That's why I left New York City. One of the reasons.
I wonder Ron would never live here, would he?
So I was talking to him about it. His daughter lives here.
Oh, really?
He comes here a lot. Yeah. And I said to him, we were just talking because, yeah, I'm probably moving to Arizona. I told you earlier, I love the hikes out there. It's beautiful. I told you to go. And I was talking to Ron about it. I was like, I don't really know what I'm doing. I just know that I love New York, but I cannot live there. And he was like, it's a great place to travel to and visit for a few days.
Yeah.
And it's true. It's a very sympathetically driven city. Although we're here right now, we're in the middle of Manhattan, we don't feel it this minute. But as soon as we go outside and we get beeped at, your sympathetic nervous system goes whoop, right up. So it's a hard place to live.
Yeah.
But it's fun.
It's a great place. It's so good.
It's awesome.
I've noticed it in the last couple of days. I have missed my kind of walk in nature.
I'm sure.
I have. I actually went for a run on a treadmill in the gym. There's a gym in the hotel. I did it yesterday, and like the hotel gym is tiny. It's like a little black box, and the treadmill was like jammed up against the wall. And
it was there.
It was just a weird run. It just felt weird. Like now, but I don't run on treadmills anyway, so it probably feel weird to me regardless. But I only did like 2 or 3K. I don't know, but it was just a weird run. It just
have you slept well since you've been here?
And not that well, but there's a time difference as well. You see,
that's true. Oh, that's true.
So I was up at like 5 this morning, which would have been 10 a.m. Irish time. So I'm getting closer to like local time. Yeah. But it's taking time. Yeah. I was like hitting a massive lull during the day. Yeah. And stuff like that.
Well, so the jet lag for sure. I came like a bit over a month ago, and it took me almost 3 weeks to actually go to sleep before midnight. There's a 1 hour time difference from Texas to here. It wasn't jet lag. It's just that New York has so much stimulus, and I'm very affected by it. Yeah. Which is interesting. Yeah.
And travel messes me up.
Oh, yeah.
On a plane. When I know travel messes everyone up. I think it's one of the worst things that people could do. Flying is probably the worst thing anyone could ever do for their bodies. I think if you're flying a lot, you're probably taking some time off your life. I genuinely believe that. It's like wreaks havoc, especially when you're going across time zones and the stress of airports, and you just feel unbelievably gunky when you get off an airplane. But for me, when I don't have space, if I'm on an airplane for like 8 hours, I don't have space to get up and walk around, and like I can feel my breathing changing and stuff while I'm on the flight. So I know how to manage these things now. Like I know really, really well how to manage these things, but like that can be rough.
I actually haven't done a long flight. Like the last long flight I did, I went to Israel, which is 12 hours. Yeah. But that was like 2 years ago. Yeah. But now I have been flying a lot. I'm also concerned, like, radiation-wise. I don't think it's good for you. That's, like, my biggest thing about it. I'm like, I always do the pat-down. I never want to go in the thing. And then they always tell me, you get more radiation going up on the plane. I'm like, I know, but I'm trying to limit it. But I've only flown, like, a couple hours, and you really don't feel good. But it just shows your environment really affects you. Yeah. So a lot of stuff, this is why PRI is a lot of psychology as well, because it's about being able to tap into somebody's like midbrain, and teach them how to like get into the parasympathetic and understand their body more and feel different things that are stressing them out and know what to do because of it. Yeah. But yeah, it's very interesting. Movement in general, a lot of times.
Yeah, 100%.
Yeah.
I think I like working a lot with athletic population. I do a lot of I push people very, very hard. I do a lot of plyometrics, a lot of like strength type of work. I won't say a lot of strength type of work, because there's people that are listening that are like, that's all they do is strength work. So not as much as them people, but like we explore a lot in our sessions. Like there's a lot of movement in the sessions and stuff, but there is a lot of strength, a lot of plyometrics, a lot of running, a lot of change of direction stuff. But I also feel a responsibility, and hopefully for some people that are maybe listening or look at the stuff that I do or the stuff that I talk about, I do feel some responsibility to help get some of this message across around this stuff as well.
Yeah.
Because maybe some of like my audience will listen to me saying it versus when someone else says it.
Right.
And I don't mean that as in like I'm great and they'll listen to me. I just mean everyone has an audience,
Yes.
and they'll connect with people in certain
platform.
ways. So I feel a little bit of a responsibility to try and, because I know there is a lot of people shitting on it. So I'll try and like just not push back on that. I don't find I don't find that helpful at all, but I'll just try and like bring some good information to the fore, and then the people who are interested and want to learn about it can listen and go further and stuff like that.
Yeah,
then.
spread the positive for sure. I think that's really important right now too, because I do think there are a lot of people that are definitely shitting on it, and I think that those people many times don't fully understand it, and so it's easier to shit on it.
Yeah.
Or they're frustrated, so they've done whatever they feel like doing, and they want to try to, outwin somebody.
Yeah.
The other thing too is, just with PRI in general, like we were talking about, like misconceptions. You were just mentioning strength coaches. I think a lot of strength coaches just don't think it works, but it was not meant for strength training. I am a strength coach. I had an Olympic weightlifting background. I do not really do that anymore, but I still train people. I have clients that I work with and train, and I use all of these principles of PRI to train them. And my clients feel great because I'm training them very asymmetrically, very unilaterally. My population is not really, I'm working with like, let's say women in their 40s and 50s. So my population isn't necessarily athletes, but can this benefit an athlete? Sure.
Yeah.
You're utilizing it, and it's benefiting your athletes. And I think strength coaches, when they look at it, they think, oh, what is this rehab? Or this is the 90-90, for example. It's such a simple thing. It's not actually simple. When you're doing it properly, it's very difficult. Many, like pelvis forward on both sides, PECs cannot do it.
Yeah.
And I think that those strength coaches maybe can't experience it themselves.
Yeah.
Maybe because they're locked up elsewhere. They've never had a real assessment. They haven't gone to a good clinician. So instead of really diving in and learning it, because it's so complicated. To learn it is hard. So instead of really learning it, they're just going to say, it doesn't work.
Yeah.
Instead of understanding, it's not about how high intensity the technique is. It's not an exercise.
It's the opposite.
Technique.
It's actually the opposite of that.
Yes,
It's how well you can
exactly.
relax. And there's a lot of coaches that will say, I actually have to like preface, not so much anymore. I think like I've gained a certain level of respect in the strength coach community, or I've helped some strength coaches who are working at a high level with athletes, and I've helped, like they've come to me and we've worked with their athletes together. So I've gained, I think maybe there's a lot of people out there who probably hate me as well, but I've gained a certain level of respect with some of those people that I can kind of talk about it, and they're like not just going to be like, okay, straight away, this is bullshit. But sometimes I have to preface it and say, okay, we're going to do an exercise. I don't use like a 90-90 hip lift really anymore, but like whatever. But we're going to do an exercise, and like they'll say, I can't feel my hamstring. And I, even before that, I'll preface it and say, don't automatically think that if you can't feel what I'm asking you to feel, it's because you're too strong. It's very likely that it's because you actually can't relax and get into the right position.
Yeah.
So like my preface is two things. This is going to take me a little bit of time to like coach you through. Yeah. And I don't want to get frustrated with you as you learn it, and I don't want you to get frustrated with me as you learn it. Okay? Are we happy with that? Yeah. Okay, let's go. They try it, they can't feel their hamstring, but now they've already know, okay, I can't feel my hamstring.
Yeah.
He already said this might be the case, because straight away they'll think I can actually RDL 150 kilos or deadlift 150 kilos or do X amount on the hamstring curl. And then when you actually get them into the position, their hamstring freaks out. So like that's the same with even like one of my exercises, foam roller bridge and stuff like that. Putting people into a position, then they can feel it.
Yeah. I mean, I think of myself when I back squatted double body weight. I was a small body weight, but that was very heavy. And I know I could not, one, adduct on either side. And two, if you put me into a 90-90, I would not feel it. On the lift test, there's no way I would get anywhere. I probably had like a 1 out of 5. Neurologically, my connection to understanding that left side of my body was gone. But I was strong, sure. Strong in my pattern, really strong. I love my right side. I could do it all day. And a lot of people that can't feel things properly, it's because they've never been put in the position to do something opposite of their normal pattern. You're putting somebody in a 99, it's opposite. You're putting them into spinal kind of flexion. You're getting their ribs back and down into internal rotation. You're pulling their pelvis underneath them so that their femurs can eventually adduct and abduct. This is completely different than what they know how to do. And a lot of like lifters, strength coaches go hard.
Yeah.
It's not that. It's not an exercise. You're not trying to go balls to the wall on this. You're trying to do it very, very gently so that you can sense. It's not about strength training. It's about sensation to your brain, the connection to your brain. Do you feel this?
Yeah.
And it's slight. And those little slight movements, like you should be dying on a PRI technique. They're so hard when done properly.
Yeah.
If your path though, like I was, like I will cheat anything. I'll cheat all the techniques. But if I'm put into the right position, I will shake like a leaf.
Yeah.
And that's when you know you're like really impacting the nervous system.
Yeah, exactly. And the people who can't feel that, it's not that they're too strong. It's not that they're too good. It's usually the exact opposite.
Exactly. And I think that's a big misconception because people just think, oh, it's voodoo or it's not. If they're saying it's voodoo, they don't understand the science. That's number one. And if they're thinking they're too strong for it and they're a power lifter,
they just haven't been coached through it.
Exactly.
Simple as that. Yeah.
Exactly.
Yeah. But it should never have been. I just don't get the strength coaches who shit on it. Like, if your client was coming to you to get stronger and to lose weight and get fitter, why did you have them lying on the floor breathing in the first place? Like, the critique is like the meme of strength coaches who put their client on the floor for 30 minutes before doing a session. It's like, why were you doing that in the first place?
Yeah, that's true.
Whatever about doing like 2 sets of 5 breaths before you get started for whatever, but like, who are the people that are actually doing this?
I don't know, because even the clients I strength train, they feel good. So I'm not spending the whole session doing PRI with them.
Yeah, exactly.
They're doing 1, maybe 2 techniques before, which takes an average of 6 minutes.
Yeah.
Like 2 sets of 2 techniques, 3 sets maybe. And then they're doing 1 technique at the end.
Yeah.
And we're strength training.
Yeah.
So I don't know where that comes from. The memes on Instagram is definitely a topic that we could dive deep into.
No, let's leave that.
That's something I don't like to participate in. It gets me heated.
Yeah.
But no, I don't know. Ultimately, you should be upright, especially if your person has no pain. If they're coming to you because they want to strength train, but they also have low back pain and neck pain, then maybe they should be sent to somebody to deal with that first before you go and train them really hard.
Or at the same time.
Yeah. Or at the same time.
Yeah.
Because you can easily do both.
Yeah, it's not meant for strength. Like,
this is deeper than strength training.
I think they should understand it. I definitely do.
Yeah.
But like, it's not. Why would you? Again, this comes back to knowledge, like not getting dumber. So like, the answer isn't don't learn this stuff. The answer is learn it and know when to apply it.
Yes, big. That's really true. And you can work on different spectrums of it. I do sometimes. I have like a few. I don't really take strength training clients anymore just because I love PRI and it's challenging, so I'm more focused on that right now. But I'm mainly a clinician. I'm using my certified athletic training license to be a clinician. So it's whatever you want to do, you can use it to that extent. If I train people, I'm not using it as much. I use my strength training background. I use the principles and I go from there. So you can take and pick what you like for sure. But being a clinician at this point, it's changed the way I view everything that I took FRC. I've taken tons of other things. I wouldn't even classify, I don't even classify PRI as a system. Yeah. Because the overall view of the body, the way that it's laid out is just completely different than FRC. And not to say anything bad about any other system out there. I just think PRI is it's entirely a different situation. Yeah. I don't like to say that that's a system.
Yeah,
I don't.
I would agree. I think I would agree with that in terms of it's different. It's definitely different. I think Ron is trying to do has an impossible task, which is trying to understand and explain how humans move the way they do.
And it just comes to him. He's watching him treat was like
Yeah.
Pretty amazing.
Yeah.
I hope he listens to this.
Yeah. I doubt it, but
I'm gonna send it to him.
I'll have to cut out the part I said about the feet part.
No, that's okay.
I just think pronation should be trained a little bit differently. That's all. Yeah, you can. I'll chat to you on about it if you're listening. But no, that's brilliant. I hopefully, I think even in a year's time, 2 years' time, 3 years' time, if I kind of try and forecast where I'll be using a lot less of PRI practical stuff. Even I use way less than I did a year ago and 2 years ago. But like, I want this to be on the record that it's the principles behind it are what matters.
Yeah.
Not like the techniques and stuff. And I think I've found better ways for me to try and help my clients, my population. Found better ways for me to do that based on for the most part, but the principles that I learned are there and are very, very important, and I encourage people to check that out as well. So yeah,
the courses are pretty intensive. I mean, they're definitely not for
what
the lighthearted.
have you done?
I haven't done FLM.
Yeah,
I want to do that one. That's one. So I took obviously the main 3.
Yeah,
I've taken like 2 of them twice.
So myokine is more pelvis.
I love
because
myokine.
even the fucking names will.
I know, it's
like
confusing.
you're like, what the hell? So myokine is pelvis.
It's femur on pelvis.
Femur on pelvis.
Yeah.
Sorry, yeah. Because there's a pelvis one.
And then the pelvis course is more pelvis.
Yeah.
Only, which to me was very complicated. I really like myokine. I'm biased because I've been working under Casey and she teaches myokine.
Yeah.
So she's exquisite with the information, and so I feel like stronger with that information than other information.
Yeah.
And I asked her tons of questions on it all the time.
Yeah.
And then respiration is about the rib cage more, which is awesome.
I really like that one.
Me too. That was my first course. I took it with Ron in 2018.
Mm-hmm.
He used me as a model.
Oh, really?
Because I was just so patterned. Because he could pick it out. I was like 50 people. I took it in New York City.
You were like gold dust coming in. He was she's the one. She's the weightlifter here.
He like grabbed my arm. He's like, come with me.
Yeah.
Like, okay.
Yeah.
Like,
I like that one. Like
2 hours.
If nothing else, like if you took that course, at least you now know the rib cage exists.
Yeah. That's a big little tidbit to the human body that we didn't really learn in grad school, that hey, it's really mobile. You can press on a rib and it's going to go where you want it to go.
Exactly,
You can influence it with air flow and mechanics of compression, feeling your obliques, etc., using a balloon, a kazoo, whatever you want. And then after that I took I&I, which is impingement and instability, which is very interesting. I'm going to take it again next year.
Yeah.
And then I took.
That talks a lot about. He goes into the feet quite a bit in that as well. Yeah.
Feet, like calcaneal instability. It talks about the scapulas. It does touch on gait a bit. It talks a lot about like rotation of femurs and then tibias. It's very interesting.
Yeah.
And Dan taught that, and I really, really like that. I like his method of teaching. And then I took cervical with Skip and Ron.
Yeah.
That's when I was like, whoa, this stuff is really cool. Although I had been learning it with Casey.
Yeah.
Taking the course and really seeing it.
Cervical went over my head a bit.
Yeah,
me
too.
Well, they probably all did. But cervical was
as it should.
As it should, maybe. Yeah, it's not necessarily a bad thing.
No.
You try and meet people where they're at, but also like, I don't think it's bad to leave people a little bit confused, because it's like, I don't know everything here.
Yeah, that's the
humbles
point.
people a little bit. But not the one thing, but I definitely took away from cervical was try and restore the natural curves.
The lordosis. Yeah.
I have found that when I see someone with like a military neck now, they usually feel like crap.
Yeah.
Like, I don't mean pain. When I say that, I don't necessarily mean pain. They just usually have a lot of tension in their body. Tight.
100%.
Yeah. So that was like worth the admission price alone for me because I find that with most workshops or seminars that I do, if I can take one thing away and like, if let's say I see 1,000 clients this year or 100 clients this year, and that one piece of information like helps 10 of those clients, okay, that's so worth it.
Yeah. I mean, also you're taking something, even if it, like when I first took respiration, it really went over my head. I was very confused, and I sat on PRI. I didn't do anything for a year. But I remember understanding about superior T4 and that the ribs are basically flipped because scalenes and SEM are pulling them up on the right side because you're so compressed.
Yeah.
And I remember understanding the right diaphragm's bigger and stronger, and that we are standing more on the right leg a lot. And I understood if I reach with my right arm, it's going to allow me to lateralize to the left.
Yeah, push you over to the left.
Yeah.
Yeah.
So those tidbits, that was enough for me to sit on for a year. Mm-hmm. And that's it. That's okay. I took it again, home study, about a year later, I think. Or not even, maybe 6 months later, and I still was like, this is confusing. And I'm going to take it again probably in November. So just because you never know, you're going to get more information every time.
Yeah.
Yeah. And
so where are we? So we're at myokine, which is kind of femur on pelvis.
Yeah. Pelvis.
Pelvis is just pelvis and a lot of pelvic floor and stuff like that.
Inlet, outlet.
Yeah, that was like
confusing.
Yeah.
Lori does a phenomenal job, but very confusing.
Yeah.
Again, as it should be. It's supposed to be hard. This is the human body we're talking about. We're not talking about like, I don't know. I mean, everything's complicated.
I did learn a few things from pelvis. I can't remember exactly what, because it's all like muddled now where I learned it from. But I remember being like, that was like
key.
Yeah. So
they
I can't
talk
remember
about
what it was.
PECs, so that was really useful for me as I was a PEC, which is pelvis forward on both sides and externally rotated, and what's going on with that and how you get them out of it. So I like that. And she talked about shoes too.
PEC to me basically mean, or without going into the pattern, basically means like they have movement where they shouldn't have it.
Yeah, and I was at patho too.
Yeah.
Because a lot of times you'll see the PEC, they're in a position, so what do? They figure out a way to
I don't label people. I don't use the labels anymore.
Yeah, that's
You know why? I was on Reddit one day and I saw
Reddit.
I saw there's this like posture
I know what you're about to
subreddit
say.
or whatever, and it's just people like people writing in, I'm
suffering from the left AIC pattern.
Yeah,
It's like,
I was like,
you're
you
just
should.
a regular human.
People should not be diagnosing people. Like
No.
it's a diagnosis in there. So that's where I was like, okay, I'm going to stop using this stuff because it's coming mainstream now. Sorry, these labels, because it's becoming mainstream and people don't know what they're talking about.
No, I never use it with patients. They don't need to know.
No, they don't need to know.
I use it on Instagram because a lot of times I think clinicians are coming to me.
Yeah,
and
you're talking to
studying it.
coaches there.
Right.
Like, yeah.
But never to patient, because some people will take it too far.
Yeah.
It's unnecessary.
They just don't need to know. Yeah.
It doesn't matter.
Basically what people need to know is they don't even need a diagnosis. They need to know, here's what I think is going on. Here's what I think is going on. No, you're not. Here's definitely what's going on. And here's what I think is going to help.
Yeah, here's what we can do for it, and let's see if you make a change.
Yeah, and here's why I think this is important for you to do this to help you get to the next step that's going to lead you back to your goal. Exactly. That's what people need to know, way more than a diagnosis.
I agree.
So those were the pelvis, respiration, and then myokine. So respiration is more rib cage. Then there's cervical, so obviously neck.
Cervical. I took I&I, so we talked about that a little bit.
Me
and then
too.
I took he did a symposium, basal ganglia symposium, which was not this past year, it was the year before. Yeah. 2021, and that was awesome. It was a lot talked about Parkinson's and the dopamine levels in the brain, and it was very interesting. I, as an athletic trainer, I didn't really study as much like geriatrics or pediatrics, which is something I really want to study more of. I'm really interested in it as I've gotten older. Yeah. And that talked a lot more about like more conditions of aging populations, I think. Although it doesn't always have to be. And so that was really interesting, and talking about music and rhythm and how that's really important for the levels of dopamine in your brain. Yeah. So I really like that one.
Yeah, that's cool.
That was cool.
Yeah.
And then what else did I take? Occlusion, which I loved. Yeah. Because now we're talking about. Also, I had been learning it with Casey, so it's different to like my experience, because I was learning it. She was teaching me, even though I didn't have the didactic information yet. Once I took the didactic information, I had loads of questions, and I was, talking to her about it. But so I took all those last year. Yeah. So I'm a baby into it for sure. I just had like a different experience where I jump started myself, but I know about myself and I know how I learn. And Casey gave me an experience that allowed me to do so. It's very unique. Most people don't have that. Yeah. So I'm grateful. I'm gonna I'm hopefully testing for my PRT this year. So PRI has different certifications. That's my plan. I'm probably gonna take 1 or 2 courses before I test. So the testing you apply in October, and that's in January. So I want to take one course this year at least. But because I took like 5 or 6 last year, I'm not taking, and I have 3 weddings this year, I'm only taking maybe one this year.
They're a course by themselves. I considered that like kind of PR whatever a few years ago, but as I said, I've kind of
You could still do it.
Nah, I look honestly.
Come into my class.
I've moved away like in a different direction, you know.
That's okay.
But yeah, I took the fitness and movement course.
Yeah, so I was supposed to take that,
Yeah.
and then COVID hit.
Yeah.
That was April 2020. I
Yeah.
was signed up.
I think that was my least favorite one.
People said
Just
so.
didn't love it.
It's interesting.
Maybe because I thought I felt like I had a good grasp on the fitness side of it,
Yeah.
and a decent grasp on like the primary courses and stuff
Yeah.
like that. Not a decent as all, but I feel like that course then was designed for trainers who maybe
Yeah.
hadn't learned any of it. So
That's what I've heard.
yeah, so that was my probably least favorite one. But I can see why maybe if a trainer was interested, that might be a good place to start. Actually, yeah.
They don't have it right now, but
Yeah.
I don't know what the plans are for the future.
Yeah.
I know they just put out a pediatric evolution course
Yeah.
coming this year.
Yeah.
So that sounds really cool.
That could be interesting, yeah. And then one other one. What did I take? Forward locomotor movement.
Yeah, you
so
took that one.
Gait.
Yeah, I really want to take that. And I also took, oh my gosh, I totally forgot. I took non-manual techniques.
Yeah.
So basically the whole weekend, they choose techniques and Ron just talks about why.
Yeah.
And that was really cool.
Yeah.
Because a lot of the techniques resemble each other.
Yeah.
So if you have one, you can kind of understand some of the other ones. Obviously, there's about 700, I think, techniques. So you're going over maybe 20, but still it gave me insight as to a little bit more of what technique to use.
Yeah.
Because that's a big thing with clinicians too. They're always like, oh, well, what do I use? A lot of it's not always a technique you're using. It's just like how you're doing it. And then it's also like, are you calm when you're doing it? There's a lot of different elements to it. Of course, it's a technique, but you could probably give somebody many different techniques.
Yeah.
And it'll help them. Well, not as much when it comes to up here. There's just some specific ones,
Yeah.
which to me is easier.
Yeah.
Like, just tell me what to do.
Yeah.
But
I find a lot of value just coaching people how to like relax and breathe
Oh,
in whatever
big.
position. That's my favorite like quote unquote technique is just like
the alternate nostril I've been playing with lately myself. I made my mom do it, and a client last week, and it was really, really powerful.
Can you do it? Can you tell us?
Yeah, so I think it's in. I actually haven't taken cranial yet, but it's in that course. I didn't take cranial because I missed the time to register, and it was like that week.
I asked Ron at the end of cervical. It was online, and they were saying, okay, cranial is coming up next month or whatever,
That's
blah
a
blah
good
blah.
one, apparently.
And I said like how. I wrote in the chat like how smart do you have to be to take cranial, whatever, something like that. And he answered and he said, if you struggle with cervical, don't take cranial yet. And I was like, okay, that's me out.
I think cranial might be next weekend, and right now, if I don't have patients next weekend, even if I have one, because you could just do it and just catch up on the hour.
Yeah.
But I might do it last minute
because
I've heard amazing things about cranial. People say it's their favorite course.
Oh, really?
It's all about the temporal bones and how it interacts with the mandible.
Yeah.
Because it's like your TMJ.
Yeah.
Dentists love the mandible, but they don't always focus on the temporal
Yeah, that
bones.
makes
So,
sense, yeah.
and it's like pelvis and femur. That's how Ron explained it over the weekend. But
do the alternate breathing.
alternate nostril breathing.
Let's go.
So okay, so you block.
Last thing. This is the last
This is
thing.
the last thing. All right, we'll end with a really nice soothing technique that you can do anywhere. You could do it sitting. I'd say I would do it laying on your back with like your feet on like a book or even on the ground.
You
knees
just
up.
changed your tone of voice there to be like meditation.
Exactly.
Yeah.
I'm getting you
I
into
know.
it.
I noticed that. Yeah.
I'm getting you into it. So you're gonna block off one nostril.
Which one?
Let's start with your left. It doesn't really matter.
Okay.
And you're gonna breathe in through that.
I hope
right
I don't
nostril.
have like a snot in my right one now.
or that you can't breathe in around.
Yeah.
I'd probably struggle, but we'll see. So you'll breathe in, and then you're gonna switch sides
and breathe out.
and breathe out through that side. And you're gonna keep your fingers on that same side and breathe in through that same side. And then you'll switch, breathe out, keep it on, breathe back in. Switch, exhale, then inhale, And then switch. Exhale. And then inhale. And you'll notice if your nose, switch again. Exhale, you'll notice how well you breathe off one side. How well do you inhale? How well do you exhale? And you keep kind of going with this flow and this pattern. Is one side harder? Is one side easier? Does one side feel more blocked than the other? It's just information to learn about yourself. And you might feel a little bit more relaxed after that. I do too.
Yeah.
We just did it for 2 seconds.
Yeah.
Like that's something that somebody could do at their cubicle job easy.
Mm-hmm.
So.
Is there one nose, one nostril that would be more blocked usually?
Yeah, usually you'll see left.
Mm-hmm.
Sometimes more blocked, or you'll see like deviated septums.
I think my right side felt more blocked.
Yeah, sometimes. So right side is actually your sympathetic.
Mm-hmm.
Left side is parasympathetic.
Yeah. Left felt good for me.
Mine too, right now.
Left felt really good there, actually.
My right feels a little bit more blocked.
It's interesting. It's
Yeah.
really nice.
And it depends on your cranium too.
Yeah.
If you're torsion.
You know what I noticed in New York City?
What?
There's weed, smell of weed everywhere.
Oh my gosh, that's a new thing.
Because I just felt a little bit high there, and I was like, I'm actually high walking around because
because they legalized it, right? So I haven't been here since January.
I didn't know they legalized it. Because
Yeah.
here I was like, there's people selling weed everywhere.
Everywhere.
I was like,
Yeah, so I just noticed it too because I have probably been in the city only 4 weeks now, and I go in maybe once, twice a week. Can't handle any more than that.
Yeah.
So I noticed that there's trucks and then there's stores, and
Yeah.
it's like some of it was like Breckenridge, which is Colorado, which it's been legal there for a long time.
Yeah.
But I got stocks in weed companies, so I'm good to go.
You do you?
Yeah, you should buy some.
What are the stocks?
I think it's called. I can tell you in a second.
We have to say, I listen to like business and finance podcasts, and
It's
they
the best
always
way to
say,
go.
this isn't financial advice, but.
Okay,
So
this
you need
isn't
to say that
financial
in case
advice.
someone sues you.
But I got. Okay, CGC is called Canopy Growth Corporation. I do not smoke weed. It's not my thing.
But you want everyone else to, so this keeps going up.
Well, it's just gonna happen
Yeah.
if it's already here. So
Sorry, what's the name of
it's
it?
called Canopy Growth.
How do I spell canopy?
CANOPY.
Oh, what the fuck?
I don't know how it's doing. I do not know anything really about stocks, so this is definitely not financial advice. But we'll leave you with our business moment of the day.
Yeah, I can't find it.
I'll show it to you after.
I have trading 212 for my app.
But yeah, that's a big thing here. I don't know.
What other stocks do you have?
Oh, I have a bunch.
Do you?
Yeah. I've been into it this last year.
Yeah, me
I've picked
too.
up a few hobbies during COVID.
Yeah.
One of them was
I went to
stocks.
Wall Street yesterday.
Did you?
Yeah, but obviously it was a Sunday, so like it wasn't busy, but I still wanted to see it.
It's pretty cool. What else did I get? I got like some boring ones that somebody told me to get. And then I got I got CRISPR. That's my one I'm like really into, which is not doing well at all today. So
You can't look on a day-to-day basis though.
CRISPR I found off of a documentary.
I just buy like the mainstream
Like
Apple.
Zoom, Apple,
Yeah.
Tesla.
Actually, I even stopped doing that. I just buy S&P 500 now.
Oh, that's what I have too.
Yeah.
That's like the best thing to do.
Yeah.
These are the things that we can nerd about. This is what happens when you get older.
Yeah, I know. But like, yeah, I think it's important. I talk about business on the podcast
You do.
a ton as well.
I listen to a lot of yours on business specifically because I think
Not my movement ones.
I listen to your movement ones too. I listen to one of your. I don't remember which one it is. We'll look, but your business ones are great. You're a very good businessman.
I don't think so because I listen to not that I don't think so, but people say that to me a lot because
Yeah.
I talk about business and business is relatively successful. But I listen to business podcasts and stuff a lot. I'm just into that stuff, and like when I hear business people talking about business, I'm like, I don't have a fucking clue.
Well, when did we learn business? Like I didn't learn it.
I went to college and studied business.
You did.
But like you do not learn business in
I'm
school.
sure it's different than
It's
the
bullshit.
same as what I learned in grad school. Unless somebody comes to me with an ACL tear, I'm not really using my test. It's the same thing.
Yeah.
But that's I always. It's funny. I told my friend on the way here. I was like, "Yeah, he's a really good businessman."
Yeah.
So that's how I think.
I
of it.
actually probably am relative to the industry.
I think you are.
Yeah. But I have thought this recently. I'm like, maybe I'm not. Maybe I'm just I honestly, I don't want this to sound arrogant. I think I'm really good at my job.
You are. That's something too. Like, I don't like sales, so I don't do it. I don't need to. My work sells itself.
Yeah.
And that's something big too. I think it's hard for people who don't want to get on a social media.
Yeah,
and
yeah,
create
it is.
Work, but I always felt like that when I used to work in like a big gym vibe. Like, your work will sell itself if you're good at your job.
Yeah.
So that's what I count on,
Yeah.
because I am not trying to do sales when I post,
Yeah.
etc. And same with you.
Yeah.
I mean, you'll post like a Zoom video of somebody,
Yeah.
but it's like cool. They're shaking.
Yeah,
They're
it's
doing...
it's just content that's there. But like, that's why I'm thinking recently, because for a while I was like, I am really good at business, but then I'm like looking at other people in the industry who are making a shit ton of money, and actually they provide way less value than I do. They're really not good at their job, but they make a lot of money.
Yeah.
And I'm like, actually, they're good business people because they don't.
They're not.
I actually think like the money we make business wise is way less than the value we provide for people. So I know.
Yeah, that's true. I
know?
give a lot of free stuff. All my stuff is free.
Yeah.
I love when people like ask me questions on Instagram and they're asking me detailed questions about their history. I'm like, I give you enough free on here. I'm not going to give you free information about yourself.
It is a good way to be though. Give more value.
I try.
It's good to not like giving free stuff necessarily, but giving people more value than you're charging them for, because that.
Well, yeah, for sure.
It's good. I'd rather that than be the other way around, where it's like
100%.
people are paying a lot of money and then they're getting nothing from me. So
Well, it's a better humanity aspect to be able to give, free stuff versus like, here's a list
not
of...
free,
Not free.
but just valued
information.
valuable for stuff.
Yeah.
Yeah.
This is true.
Exactly.
Because even if you give valuable information, they're not going to know how to fix it, or
not necessarily.
They need somebody else.
Yeah.
But
okay, where can people find you?
Oh, so people can find me on Instagram. My name is Aleena Kanner. That is usually the place I'm most active on, and my website is my name as well, and you can just book sessions with me through there. I do see people virtually because I know that, this information is not available to everybody in different places. So I try my best to see people virtually. I'm learning Hebrew so that I can eventually do this in Hebrew.
Cool.
Yeah. Well, that's not the only reason, but it would be really cool to help people. I mean, although people in Israel all know English, it's not the best language to learn, but maybe I'll learn Spanish soon.
Learning a language is good.
It's good for your brain.
Yeah. How long have you been doing online clients? Did you do my webinar? No.
I did your webinar.
Did you?
Yeah. Right at the beginning of COVID.
Yeah.
Yeah, I did that.
Were you doing them before that?
I started actually about 3 weeks before COVID actually hit. And it just so happened that I had somebody contact me who lived in like Chicago who wanted...
Before COVID?
Before COVID.
Oh, sweet.
This was like right before.
So you were an OG before COVID?
Apparently. And then COVID happened and I started doing training.
Yeah.
And then now this last year and a half, I've been doing more PRI. But it's not, of course, it's not the same as seeing somebody in person.
Yeah.
And I will always try, especially if the person's in the States, to find somebody near them that I think is competent and knows what they're doing. But that's not always the case. And it's better to do a session virtually with somebody who, has the asymmetry background versus somebody who doesn't, or somebody that you've seen before.
Yeah.
The same treatment.
What did I say in the webinar? Perfect is the enemy of good enough. There was 300 therapists and coaches on that webinar.
Yeah.
And they were like, oh, it's not going to be as good as in person. I was like, the question is, will you be able to help this person be better than they are right now? If the answer is yes, then do online.
Right.
If you want to do online, do it.
Exactly. The biggest thing too is like, okay, it might take an extra session online. It might take a little more, but I have helped somebody, I've helped people in Canada find dentists, and I just do my best, but I'm going to help them more than an average person.
Exactly.
So I'm going to find them. If they need an eye doctor, I will find them a neurooptometrist in their area and do my best to email the neurooptometrist the background information. You got to just do your best. Yeah. And then, of course, in person. So right now I'm in New York. I'll be here kind of till October. So my plan is to be here every summer. So I'm in and out of New York so much. My family's here. So it's hard to live far from your family. So, but I'm moving to Arizona. And so that'll be starting, hopefully, seeing what's out there. so I can
Excellent.
expand some business out there. And that kind of gives me some access more to West Coast. So it will be nice to be able to go back and forth. So that is the ultimate plan.
Cool. I'm
Yeah.
excited for you.
Thank you so much.
Thanks for coming on.
Thank you so much for having me. This was wonderful.